Okay, I see people are joining now, so maybe we can start. We have the recordings as well, and we'll share them after the session. Kat, if we can go to the next slide. And so we're asking, thanks everyone. I see the thumbs up, everyone can hear us well. If you can click on the interpretation button in the bottom of your screen, cliquez s'il vous plaît sur le bouton de interprétation pour écouter ces séances d'información en français y haga por favor clic en el botón de interpretación para escuchar la sesión informativa en español. Clique no botão interpretação e selecione idioma português para abrir la sessão de informação em português. So we are asking everyone, once you select your channel, to stay in that channel for the entire session. We're going to be addressing questions and answers at the end of the session. Please use the Q&A function for questions. And at the end of the session, we'll be collecting them and answer. The chat is disabled. We are trying to have everyone pay attention to the presentations and have the Q&A session at the end so that we don't have two conversations at the same time. So we would appreciate if you can send us your questions in the Q&A. And with that, we'll just go ahead and start. Please, Julia, over to you. Thank you.
Thank you very much, Marcella, and good morning, good afternoon, good evening. We hope that there is a broad swath of people from around the world that have joined us today as we move into important, as you move in country discussions, important planning period for GC8. And the Secretariat, I'm Julia Martin, speaking as the first of several people from the Secretariat. I'm the head of strategy and policy, and we want to bring to you today an overview of tools, guidance documents, modular framework, enabling impacts guidance documents that we hope will be useful to you as you move through your discussions in country that will result in funding requests and active grants for GC8. I just want to acknowledge that there is a lot of work that is already happening right now that even started back in January and February, maybe even December of last year. And what we're presenting here is not going to counter that. We just hope that it will help refine and focus and be a support to you during this really busy time. So thank you for your time. Next, please. Going to walk through a few areas, as I said, and they'll be represented by different speakers. I'm just going to give a brief overview, and then I'm going to pass on so that we can hear more about investment guidance, enabling guidance, and the modular framework. So the first thing to come back to the basics is that in GC8, there's a couple of key themes. One is sustainability, sustainable program design, and effective transitions. Those are the overarching pieces. And then to help support sustainable program design and effective transition, there are 6 key shifts in GC8. And what you see on the right-hand side of the screen is a highlight around 3, 4, and 5. Programmatic prioritization, accelerating integration, and community systems and financing. And those 3 are very much rooted in country planning and implementation. The first and second shifts are really about the allocations and how they have been made, setting predictable transition pathways, and then how to grow and optimize the use of domestic resources. Those 3 are also really important to country, obviously, and to the work that is done on national programs. But in terms of developing the funding request, it's 3, 4, and 5. Prioritization, integration, and community systems that we would like to provide some guidance to help support your discussions. Next, please. I noted that your work has already started in country, And so the important thing in blue here is to say that programmatic areas for GC8 have not fundamentally changed. There's not something coming to you that will upset the discussions you've had thus far. However, there are things to consider. Streamlining the guidance documents and the modular framework has been done and is intended to reduce country effort. We know that these are large and complex programs you're running and designing and running, and that the work that goes into a funding request is significant. We want to try and ease the burden on that. There's an increased focus on prioritization, and that is because we are all living in a time of constraint where the resources, domestic and external resources, are tight, and in some cases have reduced quite considerably. We've looked at how to decrease the duplication between Global Fund documents and materials that are made available to you for your planning processes. It's not helpful to have thousands of pages with repetition. It might underscore the importance of points, which is what it wasn't always intended to do. But it also leaves the reader with a large and at times overwhelming amount of information and documents. We've also looked at how to be very precise in the public health language we're using and be very attached to normative guidance that's coming from the technical partners, and chief amongst those is WHO, covering all diseases and systems. And lastly, we just want to acknowledge the maturity of the national response, that the collective is not where we were 10 years ago or 15 years ago or even 5 years ago. There's been incredible progress made, and we want the documentation and the materials made available to you from the Secretariat to be useful to your current context, not a context of the past. Next, please. So the investment guidance. If you look to the right-hand side of the screen, you see HIV, TB, malaria, and RSSH. We're calling that the investment guidance, prioritizing investment guidance, and looking at what is in each of those areas and saying what should be considered a very high priority and what, based on epidemiology and normative guidance, is perhaps not as high a priority, and to consider that in your context. Below that, you see of just as important is what we call enabling impact guidance, advancing integration, sustainability, human rights, and gender barriers that prevent access to services, ensuring value for money in what is being done, and adapting to climate and the impact of climate on programs and on infrastructure. And below that, you have the modular framework. These are the three areas we'll walk through today. All of this has been prioritized. All of it has been aligned. The modular framework is a source of truth. It is an organizing way. Suman is with us and she'll walk through that. But we use the same words now throughout all of these documents, the same ideas, same priority, and with an eye for really intense simplification. Next, please. So as I turn over to Michael Byrne, who's going to start walking through the 3 disease and system strengthening guidance, just want to say that each of these guidance documents, as you find them on the website, look similar. They begin with a series of cross-cutting messages that talks about the context for HIV or for human rights and gender. It provides definitions about populations that we're concerned and you are supporting, moves to priorities. It moves to the approaches, the interventions, the activities, examples, things to prioritize and not prioritize. And it, and then where appropriate, there's a section on health products. There's reference materials for each one of these guidance documents. And we want these guidance documents to be a living documents. So as there's new information, technical guidance, these will be updated. So they're found in formats that are easy to download and easy to search. And with that, I'm going to pass over to Michael, who's going to take this triangle, inverted triangle, perhaps give a little more detail and walk through the first section. Michael, over to you.
Thanks very much, Julia. Hello, everybody. And Julia, you've walked through the strategic shifts and why we have updated the investment guidance as necessary adaptation to new realities that countries are now facing, and while maintaining our focus on the Global Fund mission to end HIV, TB, and malaria, and support countries in prioritizing investments to deliver their health priorities. My name is Michael Byrne. I'm the head of the Technical Advice and Partnerships department. So what does the new guidance look like? And this triangle shows the structure for both the prioritization guidance for HIV, TB, malaria, and RSSH, and the enabling impact guidance. And you'll see that particularly in the HIV, TB, malaria, and RSSH prioritization guidance, we have common cross-cutting messages in each of those slide decks that's now published. We have a summary of priority by disease and RSSH. The prioritization approach by intervention, which contains most of the decks, which provides rich detail per countries. And finally, a section on health product considerations for optimizing the use of health products, and resources that reflect partner tools for country decision making that should be useful in countries as they develop their funding requests. And you'll have seen that we've rebranded the HIV, TB, malaria, and RSH guidance to be prioritization guidance for Grant Cycle 8. And that focus on prioritization comes through in the material content. You'll notice that the format of the slides is also inspired by the Grant Cycle 7 reprioritization guidance that we published and worked on with countries as the adjustments that we made to Grant Cycle 7. And I think, as Julia said, and this is important, the content of and key messages are not fundamentally different around program prioritization from the long information notes that we previously published, and that is assuring and should not impact ongoing country dialogues. But the materials are far better packaged for you, our country audiences. They're shorter, sharper, more readable, and we hope useful tools. And they are, as Julia highlighted, laser focused on those three strategic shifts: the prioritization, integration, and community systems. And it's really designed to help you, our country audiences, in making hard choices to get the most impactful use of the Global Fund investments in their funding requests. With the case that many of you have now lower allocations that you had in our previous cycle. And we know that many of you at country level are already moving forward and also being, and rightly so, more assertive on self-reliance, prioritization, integration, and community systems. I think the most important work, though, is still ahead of us, even though it is underway, and that is how our country stakeholders contextualize this guidance to their unique context, to their EPI, joined up with support from our Global Fund country teams and technical and other financing partners. We don't have time here to walk through all of the content, but I want to just give a flavor of the slides and go through each of the following slides that is taken from the prioritization materials to give you a quick overview of what's published on the website and now available to you. Go to the next slide. And also to say that we are also disseminating this guidance through partner-hosted events. And for example, I was just before this meeting in an expanded group of the HIV Situation Room to talk through some of the changes to the HIV guidance and integration. As Julia said, the materials are more coherent and consistent and more precise in the use of language. And here's an example in terms of where we give clear definitions for key populations and key and vulnerable populations. And these are taken from UNAIDS and WHO normative guidance. And that clarity of language is important to keep our focus on those who are at highest risk of infection. We go to the next slide. And you'll see in the slide decks, you have opening slides on prioritization by area. here are the 28 program essentials for HIV. And our work is to support and steer country dialogues to work through the important trade-off decisions that are needed in terms of how they optimize HIV investments. Those investments need to be prioritized, how we support testing, how we support treatment, including growing the national cohorts, and balancing with prevention for incidence reduction. If you go to the next slide. And here's an example of how we look at prioritization by intervention, looking in terms of what to prioritize, and then the how we optimize those interventions for cost effectiveness and efficiency. And also the areas, as you see in lighter gray texture, that we want to deprioritize. I think this is rich detail and useful for countries. Go to the next slide. And here's an example of the resources that are available to country and links to partner decision tools. Next slide. On RSSH, the prioritization is really around cost-effective integrated health and community systems that address gaps, address barriers to access, and sustain HIV, TB, and malaria responses. And you will see a very strong push, and there's also an enabling guidance that my colleague Mareka will talk through on integration and of HIV, TB, and malaria into primary healthcare. On the next slide, here we have the TB program essentials, and you'll see that the focus on prioritization for diagnostics in TB, which is the biggest cost element of TB and a challenge for sustainability. The opportunities for countries through Grant Cycle 8 to roll out new point of care and lower cost TB diagnostics that will help reduce costs and also helpful on integration, and prioritization in terms of new MDR TB regimens, which can also enable service decentralization. In the next slide. On malaria, the prioritization is really about how we advance subnational tailoring of interventions for maximum impact, targeting with the latest and best impact tools, where those tools provide the most return on investment, and focusing on the highest risk populations. And also in malaria, very strong focus on operational efficiencies, leveraging integration and service delivery within health systems. So thank you. Let me hand over Mareka for the next section.
Thank you very much, Michael. My name is Mareka Beenrooks. I'm head of the Strategic Impact and Investment and Impact Division. And as Julia said in the beginning, the prioritization guidance that Michael talked about, together with enabling impact guidance, I will shortly walk you briefly through, and then the modular framework that Suman will speak to. They really form one comprehensive package of materials that will help you to develop your funding request. The enabling impact guidance covers, as you saw, maybe recall on the slide that Julia showed you, 5 areas that support and enhance health outcomes and increase their impact on HIV, TB, and malaria. So they're a critical element of the investment guidance. If you can go to the next slide. The first of these is integration, also one of the strategic shifts, aiming to have HIV, TB, and malaria programs more integrated into primary healthcare programs, and also look at health systems more comprehensively, linking public health system with community health systems and private sector, with a view to achieving better health outcomes, but also greater efficiencies in how we deliver services and move towards greater sustainability. If we move to the next slide. Sustainability is the next of these enabling impact guidance documents. Sustainability is a key aspect of Grant Cycle 7, supporting countries to move towards greater self-reliance and for a significant subset of the portfolio to transition out of global fund financing and move towards domestic resources of the GC8 and for some portfolios of the GC9. So it's really important that we work with countries to make sure that we jointly work towards the best possibilities for successful transition and greater self-reliance as possible. As we do that, and moving to the next slide now, we really have to look at what are the barriers that impede access to life-saving services. And often those that are at risk face barriers to accessing health services. gender, human rights, stigma, and discrimination are very important barriers. This will make it very difficult for especially people at high risk of infection to access health services. So identifying those barriers and collectively working to address and reduce those barriers is really another priority and important to achieve impact in GC8. You can go to the next. Value for money. Value for money requires to balance effectiveness, efficiency, and equity as we think about how to allocate resources in a way that maximizes impact with the limited resources most countries have in GC8. And then the last one, already Julia mentioned it, to mitigate the impact of extreme weather events and shifts in weather patterns as a result of climate change, and how that impacts health programs and health infrastructure, and how we can collectively better adapt and mitigate this impact. And with that, I am handing over to Suman to talk about the modular framework, and just adding that we'll have a lot of technical colleagues on the line who can answer your questions.
Thank you, Marijke. Hello, everyone. It's great to see you, many of you joining today. My name is Suman Jain, and I lead the measurement team within the Technical Advice and Partnerships Department. With a group this large, I will start with a simple question that many of us can relate to. How many of you have ever struggled to make sure that the budgets, activities, and indicators all line up and still meet Global Fund requirements? That challenge is exactly why modular framework exists. It is the central organizing framework for all our tools and guidance documents as we streamlined and sought consistency across different program areas. As a result, all the guidance documents are aligned with the modular framework. So what does the modular framework do? It ensures that country prioritization rooted in the national strategic plans, the emerging needs and available funding are all translated into eligible investments, clear budgets, and measurable results. So in short, the modular framework connects priorities to investments, investments to budgets, and budgets to results consistently and transparently across program areas and across countries. Next slide, please. So why were changes made to the modular framework for GC8? First, we needed to make sure it stays up to date. Technical guidance evolves, partner recommendations change. So these updates ensure modular framework categories and indicators are aligned to the latest technical guidance. Secondly, we were very intentional about indicators. GC8 includes targeted subset of indicators that are most relevant and practical for measuring performance of Global Fund funded programs. Thirdly, the changes reflect strategic shifts. Modular framework clearly needed to support where Global Fund is going, whether that's strengthening systems, improving sustainability, addressing inequalities, or focusing on impact in the current context. And finally, we focused heavily on streamlining. A consistent message we heard from all of you that the guidance should be lighter and easier to use. So in short, GC8 updates are about alignment, relevance, strategic focus, and ease of use, so that the modular framework remains a practical tool. Next slide, please. Let me briefly highlight the key updates you will see in the GC8 modular framework. First is simplification and usability. The framework now has reduced list of modules, interventions, and indicators, which makes planning, budgeting, and reporting more streamlined. Activities are clearly defined, and format is more user-friendly with improved navigation. Second is strategic alignment and integration. The updated framework reinforces integrated planning and service delivery across programs. There is sharper focus on strategic high impact areas. Thirdly, expanded scope for health system resilience. The modular framework integrates climate and health considerations across HIV, TB, malaria, and RSSH, which are embedded within the relevant interventions. It also reinforces importance of community systems and sustainable financing for long-term impact. And finally, gender and human rights. Recognizing that barriers to services are cross-cutting, human rights and gender interventions have moved from disease-specific sections to RSSH. And these modules and interventions can be included in any grant, whether it is standalone HIV, TB, malaria, or RSSH grant, or combined grants, similar to any other RSSH modules and interventions. Next slide, please. So compared to GC7, you will see significant reductions in interventions and indicators in the GC8 modular framework. There is a remarkable 41% reduction in the number of interventions. These are reduced from 208 to 154, 196 to 116. The number of modules is reduced from 31 to 24, so a 23% reduction, primarily driven by HIV. And then indicators have been reduced from 25 to 30% across different components. Next slide, please. So how was this achieved? Despite reduction in the list of modules, interventions, and indicators, what we fund essentially remains the same. The activities are now better defined, duplication removed, and description aligned with the normative guidance, with enhanced focus on integration and service delivery. Several interventions were combined into one and renamed to better reflect the underlying priorities. And indicators were aligned with the latest WHO guidance. Some of it was published late last year. Next slide, please. Next, I will give you some highlights of the changes per component. Starting with TB, you will see no major changes. One new intervention has been added. 2 new outcome indicators have been added for bacteriological confirmation of TB and near point of care testing among the notified cases. Definitions of indicators were aligned with the WHO guidance, and the disaggregations is aligned with the reporting needs. On malaria, the key change is that 5 ITN distribution interventions have been combined into one across the different channels of distribution, from campaigns to continuous distribution and routine distribution. And similarly, the ITN distribution indicators were combined into one with disaggregation by type of distribution channel. 2 new outcome indicators were added for ITN access and IPTP for malaria and pregnancy. Next slide, please. On HIV, 8 prevention modules were consolidated into one. Some prevention interventions for each KP key population maintained, but several others were combined into fewer interventions. Differentiated HIV testing services was consolidated from 9 to 3 interventions. All coverage indicators for key populations have been maintained. Stigma and discrimination related outcome indicators for PLHIVs and key populations are retained in HIV. And 4 new coverage indicators have been included for PrEP, hepatitis C testing, and 2 on advanced HIV disease. Next slide, please. So lastly, on the RSSH modular framework, the modules and interventions related to cross-cutting barriers to services, the human rights and gender related modules and interventions are included under RSSH. And despite increase in the number of modules, the number of interventions have been maintained. Composite coverage indicators have been replaced with simple, measurable, and routinely reported indicators. And lastly, the lab EQA indicator is split into 3 by test type, 1 per disease. This is where I stop, and I will hand over to Marcela. Thank you.
Thanks, Oman. Hi again, everyone. We have some questions that we received in the chat, so we're just gonna put them in the slides now. Please keep the questions coming. We're going to be responding. Ideally, we were prioritizing the questions related to this session, but we don't have so many so far. So please don't be shy and send us your questions. So next slide, please. I'm going to be also reading the questions out loud so that our interpreters can interpret them for those of you who are not listening to the English channel. So I'm going to read them through, and then I'm going to ask Marika, Simon, and Michael to take turns on these questions. Okay, so were interventions ranked according to their cost effectiveness in various contexts, or based on which criteria are they ranked? The newborn and the unborn are missing from vulnerable populations, which is a key omission. Programming around PMTCT, EID should be a prioritized investment area. Pediatric drugs also seem to be missing from the priority list. The whole GC8 focuses heavy on treatment and adult population, less on prevention and newborn children. What is the guidance note on the selection of multiple PRs and on selecting one PR and its implication for countries? The GC8 funding request application mentions that up to 3 priorities should be chosen for each component: HIV, TB, malaria, and RSSH. Given the number of modules under each component, please provide guidance on whether the up to 3 priorities should be selected at a high level or at modular for intervention. And the last question is the modular framework, I suppose, saying for payment for results as well. Michael, should I pass you on to the first question?
Yes, no, thank you, and others can jump. And one, let me just say to everybody, thank you very much for your questions. And I know it's not easy to answer these in a very large forum. This is your global fund, and it's important in terms of your questions and feedback in terms of how you hold us to account, because our purpose is to support what's happening at country level and for them to deliver their national strategies. And there's probably a lot more questions we can answer here. I think what's also important is how, particularly for those of you who are working at country level, part of CCMs, part of our partners, how you work with our country teams. If there's anything that's unclear or how to contextualize to your specific and unique country context, to follow up with the country teams so we can provide those answers. And our country teams also work with our technical teams to respond to that, because we're here to really support you, particularly because the timeframes we have are quite short. So on the interventions, so the interventions that in the guidance is not ranked by cost effectiveness. What you'll see in the guidance is we talk through the priorities that we have for each of the areas around HIV, TB, malaria, and RSSH. For example, you'll see the HIV program essentials. And what's very important there is how the CCM and the partners look at those program essentials and determine, which of those areas are really the priority for that country for the next 3-year period. Where does that correspond to EPI, to past performance? What's happening with domestic funds? How can the global fund investments, for instance, in HIV and national HIV priorities, be the most value adding? And looking at that not in a siloed way just for HIV, but also looking in terms of how the HIV program connects with primary healthcare and supporting and related to the underlying health systems like community health workers that underpin the HIV response. You will see that then under those priorities that we have by area, when we look at each of the list of the interventions, you'll see within the interventions what we expect to be prioritized and how those interventions can be optimized. And I think that really speaks to the cost effectiveness points here. and also what can be deprioritized. And I think what's very key in getting this right is really how you contextualize that guidance to the country-specific case, taking into account, probably most importantly, what the EPI is telling us in terms of programmatic priorities, and thinking holistically across all sources of funding. And as Julia said earlier, one of the strategic shifts here is looking at sustainability, the movement around self-reliance. So we need to think holistically with global fund investments and how domestic financing is being used. And then on the second question, and I love this one, let me just say that in updating the guidance, we were much more clear and precise on using public health terms. And there's no global fund terms. These are our partner terms that we use. So for instance, when we talk about key and vulnerable populations for HIV, TB, malaria, or key populations, those come directly from the normative guidance from WHO and UNAIDS. So if it's missing in our guidance, and depending how you term missing, is that's because that's how they're framed in the normative guidance. And when you talk about certain areas like EMCT, EID should be prioritized investment areas, certainly, but you have to make choices. What's the EPI telling us? What's the performance in that area? What are the other HIV priorities? And is elimination of mother-child transition, is that the most important one that we need to be focusing? And is, for instance, pediatric drugs or other drugs or testing drugs, what ones make the most sense for what the Global Fund can invest in and support the country most? And I would say grants like to focus heavy on treatment of population, less on intervention. That should not come across from the guidance. Again, that's really about how that is contextualized. I think I've already heard some of the discussions in some of the Southern African countries, for example, that at very high levels of treatment already, and you might think that might be deprioritized. But those countries also considering that they need to expand the cohort if they're going to be able to, for instance, roll out at scale products like lenacapavir, because only then with higher coverage can HIV prevention like lenacapavir be optimized. So I think that's again around how we contextualize the guidance to the specific EPI and the priorities in that sense. And the Global Fund is not, we're very insistent on prioritization, but the decision making on this really needs to come from the country level and their plans. We stop there. Hand over. Others want to add?
Yes, thanks, Michael. Is there anyone else who wants to add to question 2?
Just to say that on the first question, and sorry, Michael, if you said this, I agree with everything that you put out there. The cost, there's EPI and there's cost for cost effectiveness. And the cost is driven by the context of the country. So no, they cannot be ranked globally. You could for effectiveness of impact, but the cost angle must come from the context within the country, and the country must carefully look at cost and to try and drive those costs down as low as possible without hampering quality. Thank you.
Thanks, Julia. So for question number 3 on the selection of PRs on implementation arrangements, Natasha, would you want to come to respond? Are you online?
I am. Can you see me and hear me?
We'll spotlight you in a second. Thank you. We can hear you though. Please go ahead.
Perfect. Thank you so much, Marcella. And good morning, good afternoon to everybody. The guidance note on the selection of PRs is now available online. It is in our operational policy note for funding requests and grant making. And there it'll be very explicit on what the PR selection process is. It is country owned, but you will have seen from the allocation letters that the Global Fund strongly recommends streamlining implementers to the extent possible to be able to maximize use of funding for these programs. Thanks.
Thanks, Natasha. We're adding the link in the chat for the OPM so that it's readily available. For question 4 on the priorities, Marika, would you want to come to this question? Otherwise, David can respond.
maybe leave this to David. I would,
Yeah.
I can imagine this is mostly for focus countries, but David probably knows more.
Okay. David, are you okay?
Hello all, my name is David Nash-Mendes. I was in access to funding, heavily involved with drafting the forms, so happy to step in on this one. This is specifically related to the full review and might also apply to the core high impact transition. And the idea for this question specifically is that this stay at a higher level, at a programmatic level. What are the priorities for HIV? Not necessarily related to a specific module or an intervention, but of course those will in the end be related to those top programmatic priorities. Thank you.
Thanks, David. For question 5, if there is a modular framework saying for payment for results, and someone confirmed that yes, it's the same modular framework for payment for results. I don't know, Simone, if you want to add anything on this one.
Yes, it's the same modular framework. There will be additional guidance coming soon on the payment for result grants. So that will help you identify and select the right indicators for your context.
Okay, thank you, Simone. If we can go to the next slide, we continue the questions. We have a comment. I'm going to read it. Hi, I reviewed the modular framework handbook when it was released last week and found it well structured, clear, and user-friendly. Thank you for the effort to streamline this document. Thank you, Simone, for the succinct overview of the modular framework or for the efforts from the Global Fund team on streamlining this document. So obviously we wanted to show this comment. Thank you, Moonshot, for sharing this. We're happy to hear this. Question 7, is there a Global Fund recommended minimum percentage of country envelope budget to be implemented by community-led organizations? Is there a Global Fund recommended minimum package for country envelope budget to be allocated for human rights, gender, and community-led monitoring activities? What is the guidance on key populations versus the US guideline? And have you planned any indicators on integration? So for question 7, Marika or Julia, would you want to come on this one? It's 7, 8, and 9. I think the questions that are related.
Yeah, I can start, and maybe I think Fu is online. Fu can start. We really tried not to impose minimum standards and percentages from Geneva. This is very context specific. So that goes to question 7 and 8. For those countries that are eligible for matching funds for community engagement or for human rights and gender, there will be a matching condition, but that's separate. That's only for the matching funds. And then we are really driven, and that's for all. It's really country context specific. We want to fund activities that are based on evidence, that follow the data, that focus on those groups that are highest risk, and focus on those activities that need to be done to fight the 3 diseases. That's our mission. And that's what we will be following. Michael showed you the definition that we're using for key population and key and vulnerable populations for the 3 diseases. Those are not Global Fund definitions. Those are definitions that have been developed by our technical partners, and that's what we will be using. And they will be included upfront in the prioritization guidance. I don't know whether Paul would like to add anything.
Okay, thank you, Marika. Anyone else? If not, we go to question 10. Have you planned any indicators on integration? Someone, would you want me to give this response, or would you like to come in?
Yeah, I can respond to that. So yes, the modular framework includes some examples of the integration indicators. But obviously, integration depends on what is being integrated in what and for what purpose. And given that there are many different settings, there cannot be a one-size indicator fitting all the purposes. Rather, there could be several that can be considered, and some of these are included in the modular framework. Some are primary indicators, and some are secondary indicators that can be used as a proxy to monitor integration.
Okay, thank you, Simon. If we can go to the next slide, we'll continue with the questions. The social protection for adolescent girls and young women and keeping them in schools is under which HIV module? Are all countries eligible for climate and health funding from the Global Fund? What about policies of dual track financing and ensuring civil society PR? Good afternoon. Thank you for the presentation. Is this available offline? Would you kindly give an example of interventions under RSSH for the new models, namely gender and climate? Does it mean that gender human rights barriers to HIV should be addressed under RSSH? Where can we access the Q&A responses? Where we have RSSH that has human rights and gender and community system strengthening, among others, how will this be hosted by one grant, yet it is cross-cutting across the 3 diseases? Okay, so for the first question, Suman, would you like to come in here? Or Michael?
Yes, yes, it remains under HIV modules. The adolescent girls and young women related interventions are under HIV module.
Marianne, let us know if that responds to your question or if you were wondering which intervention, but yeah, it's under the HIV module. Are all countries eligible for climate and health funding from the Global Fund? Michael, would you like to go, please?
Okay, so I mean, there's 2 maybe elements to this. I mean, one is you'll see, and as Marika talked through, we have the enabling impact guidance, and there is a section of that in terms of climate and health, and that's to help countries in terms of when they look across the prioritization across HIV, TB, malaria, and RSSH, where the opportunities are based in their context to build resilience and adaptability to climate as part of their broader health strategies. There is also, in many of the countries have been associated with an initiative that we have ongoing, which is a catalytic initiative to support countries in terms of some of their climate resilience and response in Grant Cycle 7. And we are working with countries and some other financiers to see what opportunities we have in terms of continuing and scaling that up into in Grant Cycle 8. But that's in terms of how much money might be available, where that will go, that's still under determination. And what will be important in terms of the countries that we are working with in Grant Cycle 7 on that work concludes successfully, because that puts us on a better basis for potentially additional funds in Grant Cycle 8 around climate and health response. Thanks.
Thanks, Michael. Yeah, just to clarify on the question before, Michelle will probably come and mention it, but the adolescent girls and young women activities under the HIV prevention module, but Michelle can come in. What about policies of dual track financing and ensuring civil society PRs? I don't know, Natasha, are you still online if you want to comment on that?
I am. Thank you so much. Dual track financing is still advocated for at the Global Fund. It remains a board policy. The spirit of dual track financing can be implemented in several ways. In some cases, it could be a Ministry of Health principal recipient with civil society and private sector subrecipients or service providers. It depends very much on the country context. And again, the CCM leads this process. Thanks.
Thanks, Natasha. Okay, is this available offline? I suppose it's the presentation. The presentation will be shared after the session. Can you kindly give an example of interventions on the RSSH for the climate? Michael, would you want to speak to this? For climate, although you mentioned climate, we can call you both for gender.
Good to see me. I mean, one example, if I remember from the RSSH, is looking, for instance, in the support that we have for countries in terms of their health governance, and looking in terms of, given what's happening around climate to those countries, particularly a country like Mozambique, in terms of some of the challenges it's had in terms of cyclones and how that's impacted and disrupted supply of HIV, TB, and malaria services. It's how we can support the strategic policies of the country and their planning under the RSSH modules, so that country is setting strategic priorities that make it more climate resilient, while also supporting, for example, some of its infrastructure work and some of its key health functions to depend more on renewable energy sources, which has proven to be more resilient in times when, for instance, some of the central electricity supply has been gone down. And it's important to, and I encourage all of you to open up the website and walk through the guidance, and you can do search on words like climate, or on adolescent young women and girls, and you'll see where it's mentioned under various modules and interventions. Thanks.
Thank you, Michael. And also for the example on gender, and for the next question, which Suman was also addressing. But Michelle, would you like to come in? I think you're able to speak now.
Yes. Hi, just on thank you for the question. Maybe just to provide one example of an intervention, a gender intervention under RSSH. There is one intervention on preventing and responding to violence against women and girls. And that is captured under RSSH and is particularly relevant in context with high HIV incidents, for example, and it includes integrated services for intimate partner violence care and post-rape care in line with normative guidance. So that's one example. And then for the next question, does it mean that gender human rights barriers to HIV should be addressed under RSSH? It means in cases where countries are addressing cross-cutting barriers that are relevant across the 3 diseases, it should be captured under RSSH. In contexts where they're addressing very specific disease-specific barriers, then it would be captured under the disease-specific grant. So, for example, in an HIV grant. I hope that answers the question.
Thanks, Michelle. Would you like to answer 17 as well, and then I can go back to 16?
Yes, sure. Well, I think it speaks to the point. So where we have RSSH that has our human rights, gender barriers, and community systems strengthening, how will this be hosted by one grant? These are, as with any RSSH modular intervention, these particular interventions can be budgeted for by different grants and by different PRs, and so therefore they don't need to all be hosted together in one grant. It really has to be specific to the context and the relevant needs.
Thanks, Michelle. Someone, do you want to add 17?
No, I think it's fine. Michelle has responded.
Okay. And then for the Q&A responses, we will have the recording and the presentation available after the session. We won't have these answers in writing, but you will have the recording to see the responses to all of these questions. If you can go to the next slide. We have the next set of questions. So I'm going to read them for interpretation. Civil society organizations and communities priorities. The guidance was to identify top 20 interventions, recognizing the cross-cutting nature of network activities around the community system strengthening and CLM. Is there any guide on how to rank these interventions? Next question is, I would like to comment on the new TB indicator on key and vulnerable populations linkage to social protection. The key challenge with this indicator is defining a clear and measurable denominator, given the lack of standardized identification of key and vulnerable populations. A more practical approach would be to base the denominator on TB patients assessed for social protection needs, which is more objective and programmatically trackable. There are many indicators in the performance framework, and all are not appropriate for a program. Is there any guidance that how many indicators at least we need to include in the proposal? The focus of the prevention program is shifting from outreach volume to improved case finding effectiveness, particularly in identifying HIV positive individuals. What indicators can best reflect this enhanced focus on diagnostic yield? In the performance framework, it is a standard indicator. Can we propose transition activities under RSSH for just one disease, or do they need to address all three diseases? Okay, so Michael, I see you want to speak. Okay.
Oh, no.
No? Okay.
Not
in AP. For CSO and community priorities, I don't think we have Anna. Michelle, would you go on this one?
Yes, I can respond to that one quickly. There is no particular ranking, no guide on how to rank the interventions. It's meant to be very country specific and for communities to determine their priorities. So we don't have a guide for this. They can use, that said, there is the community system strengthening maturity framework, which is a tool that can be used to narrow down, but more as a guide.
Thanks, Michelle. For question 19, Michael, I don't know if we have anyone from TV or you would like to comment on this one, or we wait. Yeah.
I can start on this. I mean, that's a great point. I mean, thank you very much. We've looked and we've agreed these indicators with our partner indicators. Again, these are not Global Fund specific. These are partner used indicators. And again, to the point in contextualization, there are cases of where indicators, because of that context, because of the maturity of data systems, that cannot be measured. And therefore, we need to look in terms of other indicators or the work that's needed in countries, for example, in terms of having clear standard definitions of what we mean by each of the KB P populations in line with what the normative guidance. And I think as Fungi, as they suggested, it's really about taking a practical approach. We can allow customization of indicators, but we want to keep that as a minimum, because the indicators that we have within the modular framework are standard ones that all help us understand what's happening at a country level, but also help us in terms of global reporting and understanding in terms of the progress, what's happening. But thank you, that's a good question. And again, that needs to be contextualized to what's possible within the maturity of that country. And if they can't report on a standard indicator, what actions might be needed so that the reporting systems can do that in a helpful way for understanding the national response. Thanks.
Thanks, Michael. So now would you like to come on the next question?
Yeah, sure. So there is no number prescribed for inclusion in the grant performance frameworks. The indicators should be selected based on the grant objective and what is being funded by the grant. These should allow for grant monitoring and performance assessment and show value for money. And having said that, we have our KPI indicators, the key performance indicators that are recommended for inclusion in the grants where these modules and interventions are being funded by the grant. So they by default are the priority indicators that should be considered when selecting for the performance framework. Thanks.
Okay, thanks, Simon. Michael, on the HIV questions on 21, I don't know if you're or Julia would like to comment.
I can if you'd like.
Sure, thank you.
So the yield, there are places where that will be possible to calculate the yield. But what's most critical is for someone who tests HIV positive that they're linked to treatment, and what countries absolutely have at subnational levels as well is that they will have the total persons living with HIV, and they will have current on treatment. And so what you want to see is that numerator, the treatment number going up. So if you don't see that going up, and yet you're seeing HIV test positives, as you said, as a standard indicator, then there is a problem with either linkage or with retesting, and someone isn't actually new. This is quite a complex area. And if your context is struggling with this, I think it's a great opportunity to reach out for some support, either to the technical partners with UNAIDS or within the Secretariat. We have resources to help work through. But it's I appreciate the question, because it shows that people are trying to use data to the best of their ability to try and make progress. So thank you.
Thanks. I don't know, Michael, if you want to add anything.
Yeah, sorry, and I did react earlier to this question, and maybe that's triggering because we've had so much discussion in terms of transition, and I think stepping back in terms of before in terms of how you looking at transition activities. I mean, it's to state that particularly for the RSSH guidance, but it's also in HIV, TB, and malaria, that a lot of the work that we're doing in Grand Cycle 8 is to support country capacities to move and transition further into self-reliance. And a number of countries will be transitioning out of Global Fund financing in Grand Cycle 8 and in 9. And I mean, this is a good question. It's something that needs to be discussed at country level. I think it's also to define for that particular country, what do we mean by what needs to be transitioned? If you look at the guidance, there's a lot of emphasis in relation to looking at that, particularly in terms of HRH costs, and for the Global Fund to move away from covering recurrent costs, because that needs to move on to domestic, because that's just much more effective. It also looks in terms of how we continue the important contribution of civil society and community-based, community-led organizations and communities, and how we transition that financing away from international financing onto the domestic. And there's also mention of that in terms of social contracting. It relates to health financing and to labs, and also in the optimization of a lot of interventions. We are looking to ensure that we're minimizing or not have Global Fund covering recurrent costs, unless that's really essential, because that's not the right way to go forward in terms of building capacities for self-reliance and the sustainability of the results that we're achieving. Thanks.
Okay, thank you, Michael. We can go to the next slide. Okay, so is there any guidance on the recommended ceiling in terms of the number of coverage indicators in the GC8 performance framework per module or overall? The context for this question is that in GC7 there are some performance framework for 3 diseases grants, which have over 30 coverage indicators plus 10-12 impact outcome indicators. A lot of time goes into data collection, verification, reporting, and not sufficient time may remain. Framework, how does the evaluate additionally, is there any technical guide or standard indicators available help us integrate climate change mitigation into our GC8 funding indicators? Next question, if cost effectiveness is not a criterion, which factors does the Global Secretariat define priorities in these guidance documents? Next question. Hello, do the new guidelines plan to take into account information on transition, cost sharing with governments? Thank you. Our transition activities under RSSH. No, I think this question we've already responded in the previous slide, 27. I think it's a repeated question maybe. So let's go to the first one. Do you want to take some on the one on coverage indicators?
Sure. I partly responded this for the earlier question, but just would like to add, it's very difficult to propose a general ceiling across different countries and different contexts when the grants have different objectives, different budgets that are allocated to different interventions. What we suggest is you look at holistically about what that grant is trying to achieve and include the indicators according to that. Indicators should allow us to monitor the grant, should allow us to assess the performance of the key interventions that are included in there, and relative to the budgets, inform us about the value for money that we get from those interventions and that level of funding. So in short, I mean, we don't prescribe a ceiling. It should be discussed between the countries and the country teams what is a appropriate set of indicators for that grant. And especially, I do agree in a combined grant with all three diseases and RSH included, there will be a longer set of indicators required for monitoring that program. Thanks.
Okay, thank you, Suman. So we have a question on climate investments, and Michael, I don't know if you want to.
No, thanks. That's a good question. And I mean, yes, I think the new emphasis, and that's reflected, as Marika outlined, in the enabling impact guidance in terms of how we're adapting and mitigating the impact of climate on HIV, TB, and malaria. And I suppose it'll, again, context specific. It depends in terms of what is being proposed in the funding request. Is this around, for instance, health security and climate in terms of supply chain, disaster-proof infrastructure, and how it's being incorporated into national M&E systems. So depending on terms of what part of the program or the national health functions it's relating to. And like other parts in terms of how we look at the funding requests coming from countries, it's looking in terms of the evidence base, how it links to the EPI, understanding how it fits within national priorities and why that's being prioritized for global fund support, past performance within that particular area, aligning with national strategies. And also in many of these areas, some of them new, including around pandemic preparedness and other areas, is how is the country going to measure progress in those areas? Because that's important from an investment point of view. If we look in terms of strengthening, for instance, disaster resilience of supply chains, and how we're going to measure and see that, so we can see that we're getting the return on the investment and the country is using those monies to the best effect. Thanks.
Thanks, Michael. So next one is on cost effectiveness, on the criteria for the prioritization guide. And so I don't know, Michael, Julia, or Marika, if you want to take this one.
I mean, maybe unless you want to start, Julia.
No, go for it, please, Michael.
No, I mean, I think a major shift in the grants in the prioritization guidance is the focus, and Julia said it earlier, on cost effectiveness. We need to see that every dollar, every euro is being spent effectively. And this started with the Grant Cycle 7 reprioritization. We have to be intolerant of where money is not being used or where we can see a tie-in with results and impact. And if you look at the each of the interventions in the guidance, you'll see a lot of helpful points in relation to how countries can optimize the use effect of the way and how interventions are implemented that helps us on cost effectiveness. And I know too that there's also from our grant management colleagues a push too in terms of looking at grant and management costs. We really have to evolve our approach and cost effectiveness for Grant Cycle 8 if we're going to maintain the ambition that countries have working with lower elements. So I'm not sure about the framing of not being a criterion, but it's very important how we look at how priorities will be delivered in Grant Cycle 8. Thanks.
Yeah, and I think if I was picking up on what I might have said, well, what I did say earlier. Oh,
You can hear you, Julia.
Ken, I thought I was disconnected.
No.
Thank you. All of a sudden it went blank. So I think the point is that things have been prioritized, as Michael has said several times, based on epi and impact from normative guidance. And there's definitely a large body of evidence in all three diseases for that. The cost piece is very contextualized. So at a global level, one can't say this is absolutely cost-effective intervention until you know what the cost implications within a country or in a subnational setting are, or against a population. So you could have a very impactful and what should be a cost-effective intervention, but if it's delivered in a very expensive way, it's not cost-effective. And so that complements what Michael has just said. It has to be the country, as you're planning and working through what you're offering, you need to be looking for the leanest approach to interventions that have an evidence base behind them for impact. Thank you.
Thanks, Julian. So the next question is on transition and co-financing. We actually have an upcoming document on this. I was checking with Martis online to address it, but he's not there. I don't know if anyone would like to comment on this. We will share the document with the countries as soon as it's out, hopefully next week. Okay, so we're going to the next slide. The first question of this slide is, kindly share the link to get to the PR selection guidance. I mean, if it's the document that Natasha mentioned earlier on, which is the operational policy note on funding request development, it was shared in the chat, but we can share it again. For PR selection, is it mandatory to undergo a thorough competitive process, such as expression of interest, or the same PR continue automatically into GC8 without a new selection process? How can we triangulate the prioritization of the three diseases and RSSH resources to fight against climate change and health alongside that of climate and health? Does the Global Fund agree to finance the acquisition of inputs other than those related to the three diseases, excluding ICCM, Integrated Climate Change Management? Key populations include sex workers, MSN, transgender people with, sorry, I forget all the acronyms and I'm meant to translate them for the interpreters. PWIDs and prison inmates. You have just added vulnerable populations to the same groups. Would you please specify which vulnerable populations these are? Is there any guidance available for countries invited for the program continuation approach? Well, there's a response there. The recently published assigned funding request and signed quality grants operational policy note includes more detail and is available on our website. The link to this document will be shared in the chat. In the context of GC8, how can NGOs in the country be considered eligible for selection as sub-recipients under the Global Fund grants? For PR selection, I think we responded to this question already. I don't know, Natasha, if you want to come back to these. You're still online.
Yep, absolutely. So as I mentioned previously, this is a country-led process. The CCM policy is very clear that the selection process needs to satisfy three criteria. One is the nomination at time of submission of the funding request. The second is documenting a transparent process for the nomination of all new as well as continuing PRs based on clearly defined and objective criteria. While this doesn't need to be a competitive process as such, it needs to be transparently communicated with as stipulated, defined, and objective criteria. And there must be a documentation and management of any conflicts of interest that may affect the PR's nomination process. And that's in the CCM policy, which is also cross-linked in our OPN that I mentioned earlier. Thanks.
Thanks, Natasha. So again, on RSSH and climate, I think you addressed some of these, Michael, but I don't know if you want to come back. You're on mute.
Yeah, all right. I mean, thank you. I mean, I think the important point I would say here is, I mean, one is how to do it, but I think that's the approach. That's an essential approach in terms of countries triangulating the prioritization across the 3 diseases and RSSH, not doing that in a siloed way. But I think one of the keys here, and this differs by country, but it's really first grounded in country plans and strategies that should encompass the 3 diseases, infectious diseases, and how the country is positioning in terms of health resilience. And that's what the country dialogues are set to work through, how they prioritize across, particularly in relation to response to HIV, TB, malaria, and health systems. That's fundamental. And I think a key part of the triangulation, and it's an important strategic shift for Grant Cycle 8, is the emphasis that there's need to happen in the country dialogue around what the country pathway and vision is and how it implements it around integration. I'll stop there. Thanks.
Thanks, Michael. Marika, would you like to add to this one?
No, I think just to reinforce what Michael said on question 30, that it really should be directly linked to improving disease outcomes.
Thanks, Marika. On the question on key populations and the definitions, Marika, would you like to on this one? Or
yeah, no, happy, and I see Michelle and Vu can complement for. UNAIDS has defined indeed the 5 key population groups for HIV, but in addition to these key population groups, these specific groups, we also know that adolescent girls and young women are at particular risk of HIV infection. And there's other vulnerable population groups depending on country context. So that's why we sometimes for HIV we specify for key populations when we specifically talk about those 5 groups that have been defined by UNAIDS as key populations. And sometimes when we talk about the broader populations, we talk about key and vulnerable populations. And it's quite well explained in the prioritization guidance.
And may I just add that we tried to reconcile between other technical partners that TB also has, Stop TB also has a definition for vulnerable populations. And so we brought those together very clearly, as Marika said, looking to harmonize those definitions.
Thanks, Julia. Thanks, Marika and Michael. So in terms of question 33 on how NGOs can be considered as sub-recipients, Natasha, I don't know if you want to complete with your previous answers to this one.
Thank you so much, Elgin, for the question. Again, it's covered now in the design funding requests and sign quality grants OPN. The link's available in the chat, and do please refer to the annexes for SR selection. That's very much undertaken by the principal recipient. It's a PR owned and led process with CCM oversight in some cases. Thanks.
Thanks, Natasha. We're going to the next slide, and this is our last one because we have 10 minutes left of this session, and it's actually the last questions that we have. We actually haven't received more questions after 38. So first question is for gender and human rights modules in the RSSH component of the modular framework. There is only one indicator proposed related to rape. Can countries propose other indicators for gender and human rights if they wish to? Another question is, please, on the indicators, we should reference the universal indicator definition, which could facilitate reporting using the conventional tools, especially now that key population services are being integrated into the health facility. In the design of integrated HIV, TB, and malaria modules under GC8 resource mobilization, how can we strategically accommodate peer outreach workers serving key populations community treatment supporters for TB, and community mobilizer volunteers for malaria within high burden, low income country settings, ensuring sustainable financing, equitable recognition, and strengthened community-led response. Next question, digitalization of the PHC is quite contemporary and key to UHC 2030. Besides malaria, what other interventions are we targeted for digitization? And the last question, what type of investments are eligible as part of primary healthcare infrastructure's upgrade to facilitate HIV, TB, and malaria services integration? So for the first question, Michelle, would you like to come in, or Suman on the indicators?
I can take that, and Michelle, you can add.
Yeah.
So we normally recommend countries to use the modular framework indicators as much as possible. But yes, in exceptional cases where appropriate indicators are not available in the modular framework, custom indicators may be proposed. We will also be sharing a illustrative list of work plan tracking measures as well for some of the modules where standard indicators are not available.
Thanks, Mom. Can I let you take the next one on the indicators too then?
Yes. So yes, fully agree. We should use the universal indicator definitions for indicators, and that's what we have attempted to do in the modular framework. Most of the indicators in the modular framework are taken from the technical partner guidance from WHO and UNAIDS. The indicator guidance sheets that have also been shared include the measurement guidance, which is also aligned with the partner recommendation.
Thanks, Mom. If Michelle, do you want to come in to add to 34?
Yes, just a very small addition to question 34 on the indicators, just to flag as well that there are also at the outcome level indicators for human rights in the RSSH section. So they're on health facility staff with negative attitudes towards key populations and people living with HIV. And then within the HIV and TB sections, there are also indicators around stigma, avoidance of healthcare as a result of fear of stigma and discrimination across different the different. So just wanted to flag that. And for gender, also just to say there are gender-specific indicators, of course, across the modular framework related to integrated services for pregnant women, ANC, and HUIW HIV prevention indicators.
Thanks, Michelle. The next one is on community involvement. I don't know, Anna, if you're on the line and you want to address this question, or Michelle, you want to take it on?
Yeah, I don't think Anna's on the line.
Oh, no, she's there.
Sorry. So for this one, we would encourage countries to ensure that peer cadres are integrated within the formal cadre where meaningful, where possible. Peer cadres, of course, we know are critical to ensure access and demand generation. So to find ways to integrate them and among the integrated cadres. We could say a bit more under the different categories, but I think it's a really important question and of course very context specific, but perhaps Michael wants to add on that one.
Thanks. I mean, okay, one, there's beyond the strategic prioritization in terms of outreach workers and community health workers, which are quite key in most countries. You'll see some good guidance in terms of community outreach and health workers under the HRH modules in and interventions in the RSSH, and you'll see them under HIV prevention interventions and also under TB treatment. So there are good references in the RSSH, TB, and RSSH, HIV, and TB guidance. Thanks.
Thanks, Michael. So for digitalization or digitization, which is different, but is there anything, Michael, you'd like to add along with the next question, which is maybe on integration.
I mean, both these are quite. I mean, digitalization is something that is really key in terms of how we look at the interoperability and integration across health system functions and between disease interventions and broader RSH. For example, how we're looking in terms of some of the digitalization of malaria mass campaigns that support in terms of gathering data that's used for in terms of mother and child health. So you'll see that both within the disease modules and digitalization, and you'll see it in the RSSH elements. And support in that area is strongly encouraged, as it is for the M&E systems. And I think on the last question, I'm looking in terms of infrastructure upgrade, facility, HIV service integration. Key theme, as you know, is integration. I mean, again, context in terms of how that is done. There is specific mentions in terms of infrastructure, also relating to the theme of climate in terms of looking at solarization on that. Look, and I would say that we often look we have a higher bar for a lot of the infrastructure that might be proposed by countries, because is the Global Fund the best avenue to support infrastructure, if that's what I'm understanding from this question, upgrades, raw infrastructure, rather than or as part of a maturity of those health system functions. And also, when I look back, for example, in terms of the COVID response funds, we often had a lot of challenges in terms of the implementation success of infrastructure work. So we support the integration. We want to mature health systems, and infrastructure can be part of that. But I would say, and this links to the point on cost effectiveness, we often have challenges in terms of supporting infrastructure because of the effect and effectiveness of that. And that's often best done through domestic financing rather than looking in terms of, is that the best use of Global Fund financing? But others may want to add to that. Thanks.
Thanks, Michael. So as I said, we finished and we have 1 minute left. If we can go to the next slide, there's a couple more questions. So the next one is that if there are any technical questions that are not non-country specific questions come up on M&E after reading further the modular framework handbook, what channel should we use to ask these questions and get Global Fund clarification? So we just put in the chat an email address where you can send us further questions if you have, but obviously our country teams, whether the questions are specific or not, it should be the main channel for your communications and addressing whatever questions you may have. So we encourage you to go to the country team first, because in any case, we send you the address to make it easier for you as well, but all of our questions also go through country teams. And then the last one is on climate change and impact on health. Again, Michael, if there's anything else that we could just add in terms of prioritization of the topic, that would be great.
Maybe the way to finish that is, I would encourage you, if you're interested in this area and the countries investing that area, read the mitigation on impact on health enabling guidance, and look through the RSSH prioritization guidance, which does make reference also to this in a number of the modules and interventions. Thanks.
Okay, thank you to all the presenters. Thank you to the interpreters. Thank you to all the participants that came today. We really appreciate your questions. And we have a survey that we just put up, if you can just take a couple of minutes to vote. And yes, if there are any questions, please don't hesitate to go to your country team or send us an email. We'll share the recording and the presentation. And thank you again for your time.